Hey, this is Georgina Zagara Chavez, your wellness consultant, specialized in decreasing belly fat. Okay, now what it has to do belly fat with pre-diabetes? Well, it's always been linked diabetes with the belly fat. For whatever reason, the experts say and the studies show that if you have big belly, you're more prone to be diabetic. Anyways, what is pre-diabetes? This is a stage prior of becoming diabetic. So the reason why I'm mentioning is because you got to be aware, besides the looks of having a big belly, is also other health problems that they can develop as a result of the belly fat. Okay? What is prediabetes? Prediabetes is the state in which some, but not all, diagnostic criteria for diabetics are met. It is often described as a gray area between normal blood sugar and diabetic levels. Before people develop type 2 diabetes, they always have prediabetes, blood glucose levels that are higher than normal but high enough to be diagnosed as a diabetic. Doctors sometimes refer to prediabetes as an impaired glucose tolerance or impaired fasting glucose, depending on which test was used when it was detected. This condition puts you at high risk of type 2 diabetes and cardiovascular disease. Here are some of the things that you got to look for it if you're pre-diabetic. If you have fat around the abdomen, that's a sign of the pre-diabetic, okay? Overweight, high blood pressure. A lot of people, they have the big belly and they have high blood pressure, but they don't relate it with diabetes. It's like your way to go to diabetes, okay? So, high blood pressure, high cholesterol, high triglycerides. Constantly exercise at least 30 minutes a day. If you do it, you're probably not pre-diabetic. But consume a lot of pasta, white bread, candies, pastries, etc., etc. Do you consume fast food at least once per week? Do you have trouble losing weight? Are you over 45 years old? These are the questions they ask you. And if you say yes to more than 3, most likely you are pre-diabetic already. The good news, hypoglycemia and pre-diabetes is reversible. It means you do not have to settle to be diabetic. A lot of my patients, they come and say, because my mom is diabetic, I have to be diabetic. I have to have diabetes. And I'm like, no, that's not how it is. Diabetes is a condition from your environment. It's environment. Your environment determines if you become diabetic or not. This is a program that can help you to reverse it and enjoy life again. The program that reduces belly fat will help you to prevent and reverse diabetes and pre-diabetes. Okay? So anyways, this is Georgina Salgado again. And thank you for listening. And again, see you in my next video.